Hi, and welcome to this week's episode of Rewrite the Mother Code with me, your host, Dr. Gertrude Lyons. Today, we're going to be talking with Dr. Mary Ella Wood. I know Mary Ella through kind of circuitously through my husband, and then we got to meet them as a couple. Anyway, we'll get into some of those details. Not the most important, but she's someone that I've had enough contact with to know that the work she's doing as a doctor in the world of medicine and integrative medicine is really beautiful, and I'm looking forward to learning from her, to connecting with her. She also recently gave birth. I say recently, within this past year, so that's recently enough for me. And we're going to be able to talk to her about that journey. So let me tell you a little bit about her. Dr. Mariella Wood serves as the medical director of the Osher Center for Integrative Medicine at Northwestern Medicine. She's a board certified physician with specialized training in osteopathic manipulative medicine and integrative medicine. Her diverse medical background includes prior training in general surgery, wilderness medicine, and an inpatient based family medicine residency with a focus on intensive care and high risk obstetrics. She brings a whole person approach to her practice, blending evidence based integrative care with tools from functional medicine, herbal medicine, Ayurveda, and nutrition. She's a certified yoga teacher and an AFMCP certified through the Institute for Functional Medicine. So she has been studying and working really hard in this field. So she's especially passionate about the emerging field of psychedelic medicine. She conducts research in the space and is the creator and host of the Trip Lab podcast, where she explores the science, safety, and potential of psychedelics through evidence-based insights and interviews with thought leaders in the field. So, as you can see, and that's just her, work world and work life that we get to dig into. I also know her as a person and as a new mother, and we get to really watch how she's integrating all of this and adapting to new motherhood as she mothers her patients. All right. So without further ado, here we go. So as promised, I have here with me Dr. Mary Ella Wood. Mary Ella, thank you so much for being here today.
Thank you so much for having me. I'm excited to be on the podcast.
Yay. I started to mention, and then I'm like, oh, it got like a little confusing. Yeah, I know Mariella, but through our husbands and da da da. And so, not that all of that matters, but I've had the chance personally to be able to know you a bit and know the beautiful work you're doing through that avenue, and celebrate you and celebrate you and Alex before your baby was born 9 months ago,
Mhm.
and plan to continue celebrating you along the way. So thank you so much for being here.
Thank you. I'm happy to be here.
Yay. All right. Well, we're going to get to into all the things because I shared your bio, talked a little about. I'm like, oh my gosh, there's any one of the things that you've been practicing and studied and do in your work could be an episode. So we don't necessarily have to cover it all, but we can get a good taste. But mostly, I would love to just start things off hearing about you, your journey as a woman, as a doctor, as a now, mother of a son, all the things, and no particular order, no particular format, just bringing us up to speed on you and your journey.
Yeah, definitely. Yeah, and thank you again for having me. I'm very excited about this. So, I guess kind of brief overview is I'm an integrative medicine doctor. So, I actually started out my medical journey in general surgery. So, I did 1 year of general surgery residency. It happened to be during COVID. So, during that, a lot of my surgery rotations got converted to ICU rotations. And then I ended up just exploring more about integrative medicine and what the evidence is out there, particularly to start by treating COVID. And then through that, I discovered that I wanted to switch career paths completely. So I switched to family medicine residency. And then within that, started to do more integrative medicine training, like some nutrition courses, some herbal medicine courses. I did my yoga teacher training during residency as well. And then ultimately ended up where I am at now. So I'm currently the medical director at the Osher Center for Integrative Medicine at Northwestern. And I did my fellowship with them as well. So that fellowship in integrative medicine. During that time, I also did some training in functional medicine as well. So I've had lots of different interests within the integrative medicine world, which I can speak to a little bit more about what integrative medicine is.
Yeah. Do you
Yeah,
want to do that right now, and then
yeah,
we'll keep
definitely.
going with the journey of
Yeah.
it all? But yeah, please, because even I, who partakes in it, sometimes don't feel like I'm really articulating and explaining what it is. I just know it's something that feels really good and right to me.
hmm And I mean, you're absolutely right. It's kind of hard to describe too, because I feel like all medicine is shifting towards integrative medicine in general. But really, what it is, so it is a specialty of medicine that physicians and nurse practitioners can do fellowships in to become board certified. The easiest way to describe it is it's like a blend between evidence based, quote unquote, alternative medicine. We're trying to move away from the term alternative, but evidence based, alternative, and holistic medicine, and then blending that together with our traditional Western medicine. So rather than just using herbs or just doing acupuncture and other traditional medicines like traditional Chinese medicine or Ayurveda, we combine everything together.
Mm.
And particularly, the evidence based part is really important, especially when you're at a big university like Northwestern. We have to make sure that what we're recommending actually has evidence behind it. So it's really a nice blend of everything. Functional medicine is just one aspect of integrative medicine that's kind of getting more popular in the media now. And functional medicine specifically is the style of medicine that focuses on getting to the root cause. So it involves a lot of lab testing. We often do like more hormonal testing and functional GI tests and things like that to work things up a little bit more. But it blends together really nicely with integrative medicine. There's a big focus on lifestyle medicine, which is nutrition, exercise, mind body medicine, stress reduction. And then the integrative medicine side of things kind of pulls more in the herbal and the traditional medicines like Ayurveda, yoga, acupuncture, things like that. So it's really really broad
Yeah.
form of medicine, and you can specialize in it from any specialty of medicine. So a lot of primary care specialties go into it because that's more of a broad category of medicine in general. But I also had surgeons and oncologists in my fellowship class, and OBGYNs are becoming certified and board certified in integrative medicine. So it's a pretty broad field.
Yeah. No, that makes me so happy, that this day is coming where it isn't an us against them,
Mhm.
which I feel like it what has been. Oh, everybody, like you had to pick a side,
Mhm.
Western, I call it Western medicine. And well, we all have our names, Western medicine, and then
Mhm.
alternative medicine.
Mhm.
Um, isn't it interesting? Just the names, like the judgment, comes out within the name.
Definitely. Yeah.
And to me, it's like what happens with masculine, feminine, right? And the values that are within them. And hearing this makes my heart so happy because I've just always felt in that realm, no matter what it is, that when you value both equally, and it's the valuing them and honoring them of the feminine value aspect and the masculine value aspect, that, oh my gosh, like how powerful, then there's synergy, then there's power. It's not one's better than the other, or one, more of
Mhm.
one, less of the other. It's like, no, they complement each other,
Mhm.
and they're not supposed to be the end all. Neither one of them is supposed to be the end all be all, right? I don't
Mhm.
know if that's
No,
your experience,
definitely.
but that's how I hold it.
Yeah. No, definitely. And I feel like along those lines too, it's more explorative too. So it's definitely merging both sides together, like you said, kind of like the yin and yang, masculine and feminine. But it's also just being open to there are these things that have worked for thousands of years. And now we're able to study it with our modern lens and see that some work, some don't, or some at least don't have evidence behind it yet.
Mhm.
Some are harmful, which we're finding out too. So that's important to
Yeah.
note as well. But yeah, it's just, I feel like it's a very exploratory field of medicine, which is also why I like it.
Yeah, no, for sure. Okay, so that helps me with also I was getting caught up in the difference between integrative and functional. What I like about when you were describing functional, and one of the things I do love about it is it's so much more individual versus like we're going to
Mhm.
figure out what works and act like, well, we have a general idea of how to treat something, and then we just give that to everybody, right? Or,
Mhm.
there's certain symptoms or that. So that's what everybody's going through. And that's not that it's that's where I think the yin side comes in, right? And the relationship
Mhm.
side and holding us all as unique individuals and really personalizing the care that you
Mhm.
get.
Definitely. Yeah. And it really kind of ties everything together too. Like I feel like also in medicine, we are kind of more sanctioned. Like we have our cardiologist who is looking at the heart and the blood vessels. And then we have the pulmonologist looking just at the lungs. And functional medicine really understands that everything is connected together. So what
Yes.
happens to your heart impacts your toes or your hormones or anything else too. So it really is like understanding that everything's connected. But that being said, too, every person has a unique makeup, and things are going to impact them differently, and so treatments should be different too.
Yeah. Oh, that's wonderful. Okay, so now just while we're in this kind of into the like, I don't know, the knowing, the knowledge part of this. So you're director of the Osher, did I say that right? Yeah.
Yeah, Osher,
Yeah.
Osher Center.
Director of
Yeah.
Osher. So if I don't know, I have something going on physically and I call Osher, what happens? Like what?
Yes, no,
I
good
don't know.
question, because this is what all my patients ask as well, or people trying to get in. So
Yeah.
we have kind of, I would say, three separate aspects to it. So we do integrative primary care, which is more an integrative approach to primary care, which you can use as your normal primary care doctor, go for your annual labs, your pap smears, things like that. And then we also have integrative consults, which is a total separate visit. So it's a little bit of a longer visit. So we have time to ask people more questions, dive deeper into like even childhood history and birth history, and then go over just more detailed specific treatment plans. So there's kind of
Mhm.
two separate visits with the doctors you can get. But then we also have acupuncture, chiropractors, massage therapy, regular mental health therapy, nutritionists, and classes as well. So it's kind of this comprehensive center that we have, and we have lots of different ways that people can get access to it.
No, that's so beautiful. Okay, so and this journey that you were on, so you were in surgery. What was it? Oh, you were in the ICU because of
Mhm.
COVID.
Mhm.
Um, so you didn't really get to do much surgery. You were kind of put there. But what was it about that? I don't know, that scenario, that space that had you start, oh, now I want to explore this and really kind of pivot in a way that you were.
Yeah, yeah. So I mean, I did get to do quite a bit of surgery because COVID
Okay.
ended up hitting like January, February, if I can remember correctly. But it was more so about I mean, it was actually prior to being in the ICU because of COVID, just thinking about how we do surgery, why we do surgery, especially with oncology as well. Like, okay, we remove the tumor, then what happens?
Mm,
And so just having those experiences made me dive a little bit deeper and just start thinking about these things.
sure.
I've always been interested. I always loved yoga. I was always into nutrition and exercise and dance, and so I always had that background. But it's not really taught a lot in medical school. We have 1 hour lecture out of the 4 hours of medical school that we go to, or 4 years of medical school that we go to. It's crazy, yeah. And so it was
Mm,
really, yeah, like, and just also being in the ICU, how everything is very protocolized. I mean, there is definitely still an art to medicine in the hospital, absolutely.
mhm.
But the protocols and like how we change guidelines based on certain studies is something that we have to do, and it's the best we have. But there was just something that didn't sit right with me. Like, okay, if this type of fluid decreases the chance of mortality in 2% of people, then we're going to change it, which 2% of people is a significant amount, statistically significant. But it just made me realize that that's how we're changing guidelines with medicine. And I feel like there should just be more to it, that there's more to it that
More nuance, more,
Mhm.
complexity than just like, okay,
Like a
we got the
percentage of this,
2%
change of that.
and everything changes, right?
Yeah.
Versus, yeah, wow.
Yeah, and
That's
studies,
frustrating.
they take because you have to account for different people, and so if you take if a person has a certain diagnosis, they're excluded from the study, and so it really narrows it down to a very specific population when we study in medicine, which we have to really know is the variable we're changing things, but everyone has so many different aspects to them, so many different types of diabetes or types of heart failure. And so when we really narrow it down so narrowly, then it really takes away what we can study, even though it's the best we have.
Yeah. Well, and it feels like, Mary Ellen, you can tell me because you're in it. These are things that I heard and maybe some time ago, so things, maybe changed. I don't know. But speaking of studies, that for so long, all the studies were done on men.
Mm-hmm,
Like so many
mm-hmm,
medical studies and so many of the ways we decided how to treat something, how to take care of it, was based on a man's body, right? Which
mm-hmm.
no one's going to contest is very different from a woman.
Yep, definitely. Yeah, and you're absolutely right. Yeah,
Oh
like
my gosh.
speaking of exclusion factors, not just heart failure, but yeah, you had to be a man to be in the studies. Obviously things are changing now, but there
Mhm.
is comparatively with what the studies we have versus for all people versus just looking at men and women, there's significantly less for specifically the woman's body.
Yeah.
Yeah.
And that's not even taking into account ethnicity,
Mm-hmm.
race, there's,
Mm-hmm.
we're all different. So it's hard to be a business that's just trying to like get people through. And, we don't have to get into, once the connection with insurance companies. So some of the
Mm-hmm.
things that dictate how things are run aren't necessarily in our best interest for care, right? So
Mm-hmm.
it
Oh
just
yeah.
gets so challenging when, I had a friend who was um, internal medicine, GP,
Mm-hmm.
and she'd get in so much trouble for spending more time with her patients than the allotted, like, you have to see this many people. You have to just get them through. And
Mm-hmm.
her patients loved her, but she
She's
was
one of the rare ones. Yeah.
getting a lot of heat for it. And
Yeah.
I'm like, that just doesn't make sense. Anyway, so we
That's
have all that. So you were starting to see and feel that way. What was this? So I kind of want to now bridge this a little bit to you and your journey. You were in obstetrics. What was
So I
it?
did I did family medicine residency, which
Family medicine.
involves a lot of labor and delivery, particularly the residency. Every residency is a little bit different, but we did a lot of high risk obstetrics. So I ended up
Oh,
delivering a lot of babies throughout residency and medical school prior to that. So yeah, so I ended up doing a lot of that in my family medicine residency.
yeah. Um, so the journey from you being in that, seeing that, and then incorporating that into the work you're doing now, and then actually having, your own baby. I don't have a specific question around it. I'm sure there's been a lot that you've learned, experienced, didn't like about about all of it?
Yeah, I definitely have a lot of thoughts about all this. So I personally loved obstetrics, loved being on labor and delivery. It was definitely, I considered being an OBGYN at one point, and loved doing that with family medicine. And I will say that even through the tired hours of residency, when I was on hour 23 of a shift, every single time a baby got born, it truly is a miracle every single time. Even if
Mhm.
I was jaded and like not wanting to go to the shift and just really tired from working multiple 24s that week, every single time a baby was delivered, it's magical. It really is the coolest thing.
Really is.
And it's just it's crazy. And I going through myself. So I personally wanted to use midwives because I worked with a lot of them in residency,
Mm.
and I like the philosophy that they're more open to, if you want to do a natural birth or like use less medications. They're more open to that. The OBGYNs are open to it as well, of course, but it does, especially in a big university setting, get more like, okay, let's crank it out, let's get these people delivered, and a lot of people do just want to deliver the baby quickly, which is totally fine. But I really wanted to go that route, especially just given like my yoga background and all of that.
Mhm.
And I had a very, very healthy pregnancy up until the
Yeah.
last minute. And then
I
I
got to
ended
be with you when you were pregnant. You
I
were
know. Yeah, I think
glowing and beautiful. It
yeah,
was
thank you. It was pretty close to when I was due, I think.
not too far, not too
Yeah.
far at all. Yes.
hmm so my vision was, no Pitocin, natural delivery, didn't want any of the medications. But then unfortunately, I got preeclampsia, which is
Mhm.
like a blood pressure complication later in pregnancy. So I
Okay.
had to be induced. So my plans were all thrown out the window. But even given all that, it was a crazy. It went by so fast, which usually, your first
First,
delivery does not go by fast.
yeah,
But it was like I think they started the medication at 9 p.m. or 10 p.m. and I delivered at 2 a.m. So it
it
was
is fast for,
extremely fast for a first
yes.
time. Yeah.
Yeah.
But it was amazing. It was like very cool to go through it. Definitely different being in it than being the doctor delivering the baby, that's for sure.
Mhm.
But
Any
it was
major differences or anything that I've talked to some women who are either nurses or, that, and it, yeah. So
yeah,
anything that you would say stood out for you?
I think the main thing was, I guess, like not major differences. Like everything kind of, I was expecting, just knowing, like, what we have to do when someone has preeclampsia and all of that. Um, what was a little bit stressful is like I know how to read the strip. And so I was reading my own strip the whole time. So every time his heart rate dipped, I would press the call button to get someone to come in. So I think that was a little bit stressful, like kind of
Mm.
knowing
Sometimes,
what's happening on the
yeah,
screen. Yeah.
knowing too much is not
hmm
always the best thing, right?
Yeah.
And in
Yeah.
that situation where
hmm
you're so vulnerable, so open, and
hmm
yeah, yeah. And so even though things got had kicked off with Pitocin, but that's still you still stay with your midwives, right?
Yeah.
For that.
Yep. We
It
still stay
doesn't
with
mean
the
with, but Pitocin you can't still get your main care with
hmm
them, right?
Yep. Still with the midwives. But it ended up like, you have to speed things along a little bit more, which is where the Pitocin comes in, like breaking the water artificially, just because when you have preeclampsia, the only treatment is delivery. So the goal, especially if blood pressure is going up, you have to deliver. So
Mhm.
I still had the medical interventions that I didn't necessarily want, but it was still with the midwives, and they were amazing during the whole
Okay.
pushing process and all of that. So it was still a
Yeah.
good experience. Yeah.
Yeah, it's definitely high on my list of ad where I like to advocate is for midwife care, right? And I
hmm
feel like midwives are the first line until you need something else,
hmm
that we shouldn't assume we need, you know, more than that,
hmm hmm
until there's an emergency, right? Until there's
hmm
something that calls for it.
Yeah. Yeah,
I'm
definitely.
a
I
big
mean, and
fan.
yeah, me too.
Well, they're
And
more,
even,
they can, it's more about for them, taking into account, obviously always safety of mother and baby, um, they're just more acclimated to the experience and relationship and those things, I think. And in general, I'm not saying it works for everybody or that every midwife is, you know, your cup of tea or perfect. Because like we talked about at the beginning, you can get in your zones and kind of be like, no, have your get too stuck in either position. So I'm
Mm-hmm.
not saying that at all,
No,
but
definitely. Yeah.
yeah, the fact that, we have so marginalized them in the United States, it's just heartbreaking to me because we're the only country that's done it to that level that I'm aware of. And it's not like we're getting better results out of it, put it that way.
Mm-hmm.
It's not like,
Mm-hmm.
okay, we'll see, like,
Mm-hmm.
a shift too far to this way is everyone's doing better. No, that's not
Mm-hmm.
panning out.
Mm-hmm. No, definitely. And I think too, like what a lot of people don't realize is, and again, going back to, I know amazing OBGYNs, like I'm not even an OBGYN and I deliver babies. And so there's lots of different people, medical healthcare professionals that can deliver babies. But if you have an experienced midwife that all they're doing is delivering babies, high chance they've delivered more babies vaginally than a lot of OBGYNs, because a lot of OBGYNs are working at big universities where they're teaching residents who are delivering the babies or they're doing C-sections. And so if you just come down to actual volume of how many vaginal deliveries, a lot of midwives probably have delivered more babies. And so that just means they have more experience in like what to do to support a natural delivery. Whereas, an OBGYN, has residents that are delivering the babies or going to C-section if need be.
Right. Yeah. And I don't know if in your time where you were really in that so much, it different things I've read. I'm by no way saying I'm an expert in this, at all. But at the same time, just, seeing some evidence that when we move away from a certain level of allowance of a process and we just want to speed everything up and get as many through as we can, it's a ripple effect. And then suddenly we see increased cesarean sections that we're all led to believe were just because like they needed them, but they needed them. We don't know how much we needed it, would have needed it if we weren't trying to speed everything along, and I think that gets really
Mm-hmm.
confusing for women, right? Or for people who are
Definitely.
birthing. Yeah.
Yeah, no, yeah. And I think kind of like a specific point of what you're talking about, there's lots of nuances to it, but
Hmm.
so there's, certain like guidelines that if you've been in labor for X amount of hours and you haven't delivered the baby or you stall, it's another term for kind of like labor's halting. There's a certain amount of hours that you have. And if it hasn't gone, then the guidelines are go to C-section. So an example of that is, maybe not guiding people to go to the hospital as soon as they have their first contraction, because then the clock might start earlier. And
Oh,
I remember
yeah.
my midwife, because I told her I wanted to have ideally an unmedicated birth. She's like, okay, we'll wait till contractions are X amount of part before going to the hospital. And so that, things like that just help the guidelines allow you to have more of a natural
Yeah.
delivery. But I think, yeah, it kind of goes to your point too.
But that's so interesting. And I don't know how much, I mean, maybe unless you say, I want, like you did, I want a natural childbirth, and you have somebody that tells you, like, oh, let's wait, you know, oftentimes a woman, oh my God, I got to get to the hospital, we're so trained. It's
Mm-hmm.
like,
Mm-hmm.
well, I should be going to the hospital, not even knowing that that is a clock that gets started
Mm-hmm.
once you arrive. It's so interesting,
Mm-hmm.
these things. There's so much you're not told, and sometimes told too much of certain things. So it's wild, isn't
It
it?
is
Like
wild.
it's
Yeah.
yeah,
And even just the stress component too, like, I feel very comfortable in a hospital, so it doesn't stress me out. But the hospital setting stresses a lot of people out. And we know that when cortisol spikes during delivery, that's more likely to halt labor or slow it down. So I think
yeah,
that also plays a role with going to the hospital too soon too, or just, being around all these medical, like people are running in and out of the room the whole time you're in labor. And
yeah,
it can be stressful for a
yeah.
lot of people.
I know. I love reading like this one woman, kind of talking about that and really kind of being on it about it. And she's like, that's like, you make a baby in the privacy of your bedroom. Nobody's watching you, but then you're supposed to deliver this baby in front of a zillion people, like, and
Mhm.
she likened it like as if that'd be, you had sex in the airport with everybody watching, and then, would you do that? No, no way,
Mhm.
but somehow it's okay. And,
Mhm.
we're just supposed to not exist as a feeling human with a very intimate thing that you're doing,
Mhm.
and, just become a patient specimen there. And
Mhm.
it just, that context has, I do believe, like can play such a significant part.
Yeah, I definitely agree. It's very, we've medicalized something that's been happening literally since the dawn of time. And
Yeah.
people delivered babies. Of course, I'm sure there's more deaths back then than there are nowadays, relatively speaking. But yeah, we've like completely medicalized something that should be so natural.
Yeah. I mean, that's what I always like to say. It's yay for, having the medicine available when it's needed, but it's kind of like so much of what happens in our culture when we have this like shiny, like, oh no, this is how it should be now applied to everybody, as if
Mhm.
as if birth is an emergency, and that gets so wired in.
Mhm.
And I work with so
Mhm.
many women who are trying to, really make this experience one that's right for them, based on their values and their thoughts. But that can sometimes mean overcoming a lot of wiring of what we've been, taught to believe for so long now. Well,
Mhm.
it's not even that long. It's, whatever, starting at the end of the 1800s into the, through the 1900s. So it's not like forever, but long
Mhm.
enough, for us to have been
Definitely.
totally rewired into thinking like this is just what you do. Like, and you don't
Mhm.
question it.
Mhm.
So yeah, I mean, I was grateful that I got put in an environment where I even knew that, because I know we've talked about this, and certainly many in my audience know I had home births. Um, but had I not had a boss who had home births, and I could hear about it, would I have even ever had known that was an option?
Mhm.
But to have somebody that I trusted, and just the way he talked about it so naturally, and it was, I tell people
Yeah.
now, like looking back on it, it wasn't some, heroic thing. It was really actually very primal for me. It's like when he talked about that he could control the lighting and they could control when she ate, like it was
Mhm.
food and lighting, right?
Mhm. Mhm.
And I'm
Yeah.
like, I'm in, right?
Yeah. Yeah.
I don't want somebody dictating my food.
Yes. And that's what they do. As soon as you get there, they're like, all right, have a snack. Because once you go upstairs, you can't eat.
Yes,
It
and
is
that's one of
crazy.
those policies, right? Like that
Mhm.
is supposed to work for everybody. And meanwhile,
Mhm.
you're about to run a marathon, and just in case you have an issue in your marathon, you shouldn't eat,
Mhm.
right? And
Right.
that one
Yeah.
just didn't make any intuitive sense to me whatsoever. And
Yeah.
it's
No.
convenient, right? It's one of those
Mhm.
convenient things.
Right. Exactly.
Okay, so now it didn't go according to plan, but you had a beautiful birth, and you have this beautiful new little boy. Tell me about new motherhood, and those first hours, days, for 9 months. It's
Yeah.
not even a full year yet, and
Mhm.
tell me about your experience.
Yeah. I mean, he is definitely the best thing that has ever happened to me.
Mm,
It is like, I mean, definitely the most life-changing experience.
mm,
I will say, like, the postpartum, like immediately postpartum period for the first couple of months, it was very, very rough. Like you learn about it in school. A lot of people get postpartum depression or just postpartum nutrient depletion and just all the challenges that come with it. But it's crazy. I feel like I mean, he was born in November, so we had the dead of winter of Chicago for him to be born in with minimal sunlight and couldn't go outside. So I think that impacted things. But it was challenging, and I like really, really wanted to breastfeed, like exclusively breastfeed, and I did for the most part. I never end up was able to exclusively breastfeed, which I think was one of the biggest challenges for me.
Mm, I
I
can
just
relate. Yeah.
yeah, I really wanted to. And I was so obsessed about it. And I think that made it worse too. But I, like in my mind, I like had to breastfeed and he could only get breast milk and I had to do it as long as I could. And it just, my body was saying no. So I ended up stopping after 4 months, made it 4 months, which I think is pretty good.
Hmm.
That was definitely, I always describe it to people like that was a more challenging period of my life than going through general surgery residency, just like the
Wow.
balancing, like trying to breastfeed and like taking
Mm,
care of this new soul and like rediscovering myself.
mm,
So it was challenging, but still, like even throughout it, like I've never loved anything more in my life. And it's every day and every month, I think it gets better. And just seeing him develop and just like being in our new life together with my husband and our baby boy and our little dog. It's the coolest experience I've ever gone through for sure. Even though it's been the hardest, it's definitely the most amazing thing I've ever done for sure.
Well, I love what you're saying, Mariella, because I think another way, we're wired and, a code that we have is that everything is just supposed to be easy or positive, right?
Mm-hmm.
And
Mm-hmm.
then I'm not having a good experience or it's limiting in some way and not accepting that uh, somewhere in that whole experience, there's going to be pain, right?
Mm-hmm.
And
Mm-hmm.
that pain, that challenge, that nothing I think they coexist so much more than we than we realize in our culture, where we just want to numb the pain or make the pain go away or make it, you
Mm-hmm.
know, easy. And you can tell me because I didn't have this, if for you, the internet or Instagram or any of those things have played a part in that, like, but the wiring, that kind of wiring was certainly alive and well and I didn't have any of that, right? It was somehow this isn't supposed to be hard, right? And
Mm-hmm.
so much focus goes into the conception, pregnancy, and birth. And yeah, you hear about it and you maybe take some classes, but I've worked with so many women and moms who are like, nobody prepared me, for those first few months, or the first year for some.
Mm-hmm.
And I think that's some of what then uh, precipitates or adds to the emotional challenge, that then escalates, and
Mm-hmm.
takes us into the postpartum depression. Whereas if, I don't know, we were around it more, we knew, and I don't even mean knowledge so much, but, we had a sense that this is hard, but I can get through it, that we really feel have a certain level of self-efficacy built up to come in. And I don't think that's what people think about, as what they
Yeah.
could work on or what could help strengthen or, give you. And I had a lot of that and it was still hard, right? Like I was very aware
Mm-hmm.
and, I don't know that there's much, but I think they coincide is really the point I'm coming
Yeah.
back to is with you saying that, wow, those first, few months really, really hard and so beautiful. And this love is growing and this, amidst these challenges, it's, it's also one of the best experiences of my life or, so
Mm-hmm.
transformative. And I don't
Yeah.
know for you, if there's things that you would name, like how you feel like I don't know if it's perspectives that have shifted or, something that you didn't expect that you've have stepped into when you say this has been amazing or
Mhm.
this has been great that you could name.
Yeah, yeah. I think it's more like presence. So I think so. I previously just all throughout my life, medical school, residency, all that stuff. I had a lot of side projects. And so I just have a lot of different interests and a lot of different side projects. And I always got up early to work on a side project and then would go to medical school and then come home and or residency or whatever it may be. I love having all these different things happening in my life. And that severely had to stop when like in the first few months postpartum, which I think was like pretty hard for me. The non-sleeping, definitely gets to you. That part I felt, didn't love it, but I had a lot of experience with that in
That's what I was going to
residency.
say. Yeah, with residency, it's like Oh, I've done this before. It's not a brand
Mhm.
new experience.
Yes. Yeah. So the sleep deprivation, I had a handle on that. It was
Sure.
definitely, longer period of time. But I think it was just, not like my time wasn't like I couldn't like 24/7 wasn't just mine anymore. And so I think I really learned like how to just be present and like just
Mm.
be active with Oliver, my baby. And I even like noticed a huge difference when coming back to work after my maternity leave, just like how I would be with my patients. I mean, I always prided myself on listening and taking the time with patients before, but I've seen a change, just being more present because I had to be with now having a baby and just being more whatever I'm doing in that moment, I'm fully dedicated to it. So when I'm with Oliver, I'm not doing side projects like in between, getting up for work. I don't have to squeeze in side projects. I've definitely gotten a lot less done in my life than I have in the past. But I feel like it's made me be more present, even just, looking at the plants in the morning or just little things like that. And so I think that that's something that has been like really joyous. And I think I've carried through to other parts of my life rather than just my time with Oliver too. So I really do love that as well.
Oh, that's so beautifully articulated and something I I would love for people to be aware of and know that that's possible, right? That, and
Mhm.
especially from someone, I'll just say this because I feel like I'm with a lot of women who their value comes from their doing, their productivity, their accomplishing. And so I think that can be sometimes the challenge of being with a newborn who you get no, those first 4 months, you get, yes, they're, there's a presence about them, but they are not with you.
Mhm. Mhm. Yeah, they don't
You
smile at
are
you for
totally
your
just
lunch.
giving to them because
Yeah.
they are not, they're
Mhm.
attuned to you in a different way, but not the way that we're used to getting
Mhm.
affirmation back from. And you're giving, 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 and not sure like what's happening on the other side. So
Mhm.
I don't think that's one of the things I don't think people are necessarily aware of, but to go from, accomplishment and doing and that mode to, oh, this is all about being, right? This is just all about, and I love you saying that about the awareness of presence. Oh, this is what what my job is right here with him is to be present. And,
Mhm.
that really throws a lot of women off.
Yeah. Yeah.
Well,
And just
that's
like,
no, I just give me something to do, please, because this
mhm.
being thing when you haven't been practicing those muscles. So I love that you saw that, stepped into it, and then saw that, oh, this works. Other like this is a translatable skill, transferable
Mhm.
skill. I can translate this into a lot of places,
Yeah.
and it's getting a positive response, right? Like,
Mhm.
who doesn't like to just be seen and heard and held? Right.
Mhm.
I mean, I just led a retreat this last week, and I think it was some of the women's favorite. So it was a self-mothering retreat. So, right, like, oh, how do I incorporate more of that or just be with things that I maybe didn't get much of in my, in my upbringing or that. And, it started as something kind of just a little bit silly, but also like I knew it mattered. And I tucked them into bed because
Oh,
in Ireland they call it tuckling. Like, I tuckled you.
precious.
So
Oh
we
my
were talking
God.
about that, and I'm like, I'll tuckle anyone who wants it. It's like every hand went up.
Oh my
Like,
gosh. I love
yes, I
that.
would like that. And they were just like
Yeah.
so giddy and sweet, and everybody just like loved it, right? And all I'm doing is like
Just tucking them in. Yeah.
just,
Oh,
doing this like little thing. So
yeah.
it's 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 such a gift. And if there's
Yeah.
anything that, I'd love for us to tune into and shift. There were so many things from what we've talked about. Okay, something we didn't get to at all, but I at least want you to take like a couple minutes to talk about, your other one of your passion projects, which is the
Mhm.
Trip Lab, your podcast, but also where you, and how you're incorporating psychedelics into your work, because we haven't touched on that yet.
Definitely.
But
Yeah,
I
yeah,
know we
definitely.
weren't going to have much time with it, but at least want to presence it.
Absolutely. Yeah. So, yeah, I can't believe I didn't mention this in the beginning. This is definitely one of my like biggest focuses or biggest interests in integrative medicine is psychedelic medicine, which is an emerging field. I feel like it's definitely out there in the media now.
Yeah.
A lot of people are talking about it. But yeah, within, so it's in the field of integrative medicine, we look at alternative, quote unquote, alternative therapies and just different ways to treat things. And psychedelics are one that are just, there's lots and lots of evidence that are coming out that it can be beneficial for anxiety, depression, PTSD, which is kind of where my interest started, just
Yeah.
how that it treats all those different conditions. But now we're finding out that it can actually, there's prospective studies showing that it also can help with cognitive decline and improving just like mental performance,
Mm.
creativity, productivity. And so just looking at how it impacts the mind is very interesting.
Yeah.
And so I started a research project with psychedelic medicine in my fellowship and plan on continuing it and eventually would like to do clinical research. It's going to take a while for all the regulations and all that. It takes a lot to get to do the clinical side of
Mm.
research. A lot of what I've been researching and writing a paper on is about how psychedelics, the mechanism of action of how it works in the brain overlaps a lot with mindfulness meditation um,
Oh,
which
wow.
mhm,
Cool.
yeah,
Yeah.
so it's and so what you can do. So psychedelics are kind of like a jump start. They really open up the mind immediately,
Sure.
but over time, mindfulness meditation can give you very similar outcomes. And they both work by decreasing activity of the default mode network, which
Mm.
is the part of your brain that is thought to be the Freudian ego. So the part of your brain that allows you to know that you are an individual. Like I like the color purple, or I enjoy this person because they make me feel special, and it's the part of the brain that allows you to think of you as you. And so both psychedelics and mindfulness meditation turn that off, and so you're
Mm.
able to see the world in such a way that you're not at the center of it, and that, along with a lot of other things, can be very therapeutic for helping with all those mental health conditions, just increasing personal life fulfillment.
Mm.
So the paper I'm writing kind of explores that a little bit more, and then hoping to incorporate more of that in my practice as the regulations kind of ease up on psychedelics too.
Yeah, I think it, I'm, you know, have a very limited knowledge, but I've certainly heard just some people who have used it in their therapy or their healing. I've heard so many positive things, so many
Mm-hmm.
positive things. So I'm not always an early adopter of everything, so I might
Yeah.
not do it like tomorrow, but there's if the need were to arise where it's like, oh, this should be something you should consider, I know I 100% would, right? Because
Mm-hmm.
I think well, I'm always a big fan of exploring the whole realm of
Mm-hmm.
possibilities when we have
Yeah.
anything that I'm wondering if when you said that about PTSD and stuff, with new mothers, is
Mm-hmm.
have you done any thinking, like, well, whatever, thinking or the study of like where would that work in? Because
Yeah.
obviously you're an individual, but like just
Mm-hmm.
targeting that specifically when someone has postpartum depression, because
Mm-hmm.
it's
Yeah, so it's a tricky area to study, just because, especially if you're breastfeeding right now, it's currently
that's
not
what I wondered.
recommended.
Okay.
Yeah. Theoretically, I mean, there's case reports and there's observational studies of women actually doing mushrooms during pregnancy and during breastfeeding, but there's no clinical trials, and so it's hard for us. It's a difficult population to study, especially if women are breastfeeding. But there's lots of anecdotal accounts of it helping significantly with postpartum depression. And I actually just created a podcast about kind of the overlap with what a psychedelic trip is like and what going through the postpartum portal is like, and how the
Oh,
mechanism, like there's what happens in your brain during both. There's a lot of overlap.
cool. Oh,
Um,
cool.
yeah, with just like how the neuroplasticity changes, how different areas of your brain light up when you're no longer the center of your universe, which, that adapts and changes as your baby
Sure.
grows. But like you were saying, like in the beginning, like you're just giving to this being, and you're not the center of the universe anymore. Like for a little
Mm-mm.
bit, the being is the center of your universe. And so what that does to your brain kind of also affects the default mode network, similarly to what psychedelics can do too. And so it can be, in my opinion, a great integration tool kind of once you've gotten past that postpartum portal, I'll call it,
Yeah.
but to do like a psychedelic journey to kind of re-understand yourself in the world, now that you're a new mother, or becoming a mother again, or whatever it may be. But I think that it can really, really help out that population of people.
Oh, that's beautiful. Yeah, just as you were saying all that, it had me wonder or think about it. Saying other people haven't thought about this, but when you unwind and when we start looking at or separating out, kind of how some of the medical world works around birth, where it's just like, it's an objective, get that baby out with as little pain as possible, like where we're ripping people off from. I'm going to call it a psychedelic experience. It probably shouldn't, but a spiritual
Mhm.
experience, an
That's right.
ecstatic
Yeah.
experience,
Mhm.
a mind-blowing that, yes, has, and not just focus on like the pain and getting rid of it, but kind of really looking at it holistically and incorporating, and what are we taking away when we take away the pain. And that's something intuitively I feel like, and just from my own experience, I'm not saying I went on a big trip, but I
Mhm.
I kind of did, and I just feel like there's so much of, if we were training women to potentially be in that space, and that's what this birth is going to be for you, and
Mhm.
let's attune to that instead of just, oh, could I, why would there be any positive reason in our current culture to even consider not using pain medication, right? Because
Mhm.
that is sometimes really hard for people to wrap their mind around,
Mhm.
like that there'd
Yeah,
be any positive out of that other than, I said I did it. But there
mhm.
are,
There
and
are.
really,
Yeah.
and to be able to put those kinds of positives out, is,
Mhm.
I think, could be really cool to add to.
Definitely.
Um,
Yeah, and even how like
Presence is the biggest one for me. I mean, the main reason I chose it was I wanted to be as present as I could, and
Mhm.
I
Mhm.
valued that. And so conscious and present, if at all possible, like that was my first choice. So um, that meant being really present to the pain. And
Mhm. Yeah, yeah.
there were definitely times I was like, oh yeah, I could totally see if I was in the hospital and at moments like, and somebody offered me a way out. I had major empathy for, it's kind of one of the reasons I did it at home too. It's like, I just,
Yeah.
I don't want that, choice
Yeah.
too easily, right?
Yeah. Right. Yeah. Mhm.
Like, let's kind of stay with this hard thing. Okay.
Mhm.
Well, I know we barely scratched the surface, but I am so thrilled, and I'm so thrilled to have covered these topics and what you've illuminated for me personally, which I know will resonate with so many people that listen to the podcast, Mariella. Do you, well, you work with people, you're a doctor, so, and just whatever struck people about how they would want to learn more, or, you know, all the different ways that you're out there in the world. Can you tell people how best to be in contact with you?
Yes, definitely. So I have an Instagram where I'm starting to post more now that I'm out of this postpartum portal about just integrative medicine and psychedelic medicine. And the Instagram handle is Dr. Mariella Wood. Just Dr. Mariella. And then I do work at Northwestern. You would have to go through them for scheduling purposes. And then I have a podcast, The Trip Lab, which we kind of alluded to a little bit there,
Yeah.
and a website too that with just more information. It's drmariella.com.
Yeah. Oh, good. Makes it so easy.
Yeah.
Um, and, well, wonderful. I am sure, and I know people are going to be interested to find out more. Super excited about that. Okay, so last question I ask all my guests, same question.
Mhm.
What does rewrite the mother code mean to you?
Love that question.
Mhm. Thank
So
you.
I think, and I mean, also probably influenced a lot by your book and your podcast too. But I think it means breaking past systems and really creating the life that you want to live for yourself.
Mhm.
And also just understanding that, which I know you talk a lot about this as well, but I think it's just really important, especially given I have a lot of patients that deal with infertility and things like that. But mothering doesn't have to just be physically birthing a baby and mothering that baby. It can, like you said, be mothering yourself, mothering your plants, adoption, mothering, just any aspect of your life. And I think that's just a really, really cool thing that you have been doing and championing. And yeah, that's what rewriting the mother
Yeah.
code means to me.
Oh, well, you've been doing a lot of it yourself, so that's why I do this podcast so we can see the myriad of ways, we're mothering our lives, we're, you know, transforming through it, we're learning about ourselves through it, we're connecting with each other through it. And but it does take work, awareness and then some
Mhm.
work. But I
Yeah.
think when we hear stories of all the ways that other people are doing it in their lives, it gives us permission, it gives us hope, it gives us, you know, real life evidence-based, through real life uh, per, evidence that it's
Yeah.
possible, right?
Yeah.
That we really can create it. And
Mhm.
I get to really underline what you talked about with presence, with presence and the magic of presence is really incredible. Well, very good. I'm so excited. I can't wait to share this. And um, thank you for being on.
Thank you so much. I really appreciated it and just had a great conversation and it was excited to connect with you again. So thank you so much.
Absolutely. Oh my gosh, what a blessing and what a beautiful soul, and so appreciate the work Dr. Mariella is doing in her practice, in her own personal life. I'm just going to take a minute to again emphasize that when we say this, like, oh, I've just learned a lot about being present, and her that she named that as one of the things that's been so transformative and so wonderful for her. I could not be, more excited and happy to hear, but also to know that one, we don't, doesn't mean that only happens when you have a baby. But it is something that uh, we can learn, right? That's a skill. And it's, Mariella has lots of years of yoga and mindfulness, training and teaching. And we don't just decide like, oh, I'm going to start being present, right? Well, we do, we say that going to start being present, and then understand that is a journey, that there's a process and that can be done. And I love working with people um, in that regard, and really supporting people through coaching and my trainings. And this one of the things I would name as in the realm of self-mothering, and something that really provides nourishment, allows us to really connect with ourselves and others. We're really only connected to ourselves and the world when we're present. And I don't care, I don't know, there's probably really evolved beings that could say that they're present for extended period of time. But even to have moments, and them when you've had them, where it's like, wow, the minute you say, "Oh my God, I'm present," then you're out of the presence. It's, it's a thing. Um, but to be in that state is really a gift and a treasure, and I'm a huge advocate for it. So I think that's it. And I just want to send you all off with huge blessings, and consider yourself tucked in from this episode, and really take care. Sending you big hugs and blessings. And please reach out with any questions, any thoughts, anything that's on your mind and heart. that I can support you with, I would love to do so. All right. Blessings.